Hello, and welcome to another We Act episode from Providence. Today, we are speaking with several caregivers about why, from their perspective, healthcare cares about the environment. I'm your host, Beth Shank, Executive Director of Environmental Stewardship for Providence. And as a reminder, the information provided during this event is for educational purposes only. If you have any questions regarding medical conditions or treatment plans, please consult your healthcare provider. Now, let's get started. It is well known that healthcare is deeply engaged with health, including diagnoses and treatments, care and compassion, community outreach, education, and more. It is less well known that healthcare writ large across the nation and the world, and certainly here in Providence, is taking more interest in caring for the environment as well. Today, we will explore that topic with three caregivers who are engaged with this work. Joining me today are Carrie Grinstead, Regional Medical Librarian from Southern California, Greg Bergman, Regional Energy Manager, also in Southern California, and Kenna Lee, RN Patient Care Coordinator and Hospice Nurse from Northern California. Each of our guests today comes from a different background and brings different eyes. So I'm going to ask them first to please describe their own responses to that question of why does healthcare care about the environment? So, Carrie, let me turn to you. As a medical librarian, you are exposed to journal articles and research studies related to environmental stewardship and our environmental crisis. In fact, you have created a listserv that collects recent articles coming out in the scientific and health literature, and you make this available to all employees. How would you answer the question that we're asking today about why healthcare cares about the environment?
Yeah, well, I would say first that we care because we are in a position to make a difference. I know I individually am always looking for ways to reduce my carbon footprint, but also as an individual, I tend to feel a little helpless, and sometimes feeling helpless translates to feeling hopeless, which of course is not good. And I think real change is really going to come from larger systems and organizations. We know that healthcare is responsible for, I think, around 10% of greenhouse gas emissions in this country. So reducing that just by itself is going to make a huge difference and also serve as a model for how other large, complex energy and waste intensive industries and governments too can really operate sustainably. Um, as you said, I monitor research literature around health outcomes of climate change and the relationships between healthcare and climate, and it's really just mind blowing and devastating how detrimental environmental degradation is to every aspect of our health, whether it's air pollution contributing to more and more severe COVID cases, to more hypertension, more cognitive impairment, heat creating new disease vectors, increased accidents and injuries from extreme weather events, the still to be determined health effects of microplastics in our bodies. And all of this obviously is putting immense strain on an already stressed healthcare system and workforce. And of course, it also increases costs and worsens outcomes. Um, and of course, in our own system in Providence, we really have to care about the environment if we're going to live our mission and our vision and our values. Climate change affects all of us, it harms all of us, but we know that it is striking and will strike vulnerable communities. So, those who are least responsible for climate change and least able to adapt, it's really coming to them first and worst. And those are the communities and the populations that we've committed to caring for from the time of our founding sisters.
Thank you, Carrie. That was so well said, and also evidence based. I appreciate that. So, for folks who don't know, Providence has really a marvelous medical library and a wonderful group of medical librarians. And Carrie has been a terrific support to our program and also just adds so much knowledge to what we need to pay attention to. So, thank you, Carrie. That was really well said. We also have a lot of buildings. We have almost 40 million square feet. So Greg works closely with our buildings and the energy side of things. So, Greg, how do you answer this question?
Thanks, Beth. I did a little bit of reflecting on this question after you were so gracious to invite me to this roundtable today. And I thought back to when I was in grade school in Kansas, growing up on a farm. I recall doing a project related to soil conservation, the impacts of wet wind, heavy rains, and other climate factors would have on soil erosion and the loss of topsoil, and the ultimate long-term viability of a farm and the impacts of the crop production. I see some parallels in our buildings in the healthcare environment. I think it's important to maintain, manage, and put them forward in a way that we can reduce the impacts to the environment while also serving the people in need. Clearly, our first goal as a healthcare system is to provide care to those in need. Having the ability to care for the community that can run efficiently and be an example to others is a part of that goal. If reduction can happen in the healthcare setting, I think we can show that it can be achieved in other industries as well. I know many of our hospitals have aging infrastructure and limited budgets, so it's not always as simple as completely redoing a central utility plant to upgrade to the newest technology. So we try to take a parallel approach on mitigating energy usage at existing buildings while also putting in new design and construction parameters around new buildings. Whether it be installing VFDs on equipment, assuring that your mechanical system is being controlled in an efficient way, reusing some of your heat loads from equipment, or even researching innovative ways to store and reuse energy and water as we transition our buildings into something that reduces the impact on the overall energy sector and our local communities. I see it very similar, saving your topsoil as a farmer so that you can produce a better crop. You want to conserve your energy, be a leader so that you can serve your community and the healthcare of others within that community.
Thank you, Greg. That's a really cool analogy. So you're saying that by caring for the soil, on which we depend to grow food and to maintain landscapes, really, and other animals and ourselves, is similar to caring for the building stock. Because in the buildings, we are all about the people, of course, and the care that we deliver, but we do this in buildings, and buildings make a big difference to health. And as you said, they use a lot of resources that we're trying to dial down through ultra efficiency so that we can actually get away from those greenhouse gas producing substances like fossil fuels. So that was really nicely said. Thank you so much for that, and also for your work on this.
Thank you.
So, Kenna, let me turn to you. You are a hospice nurse in Northern California. You have also lived through several very tough fire seasons that threaten health. And I also want to point out that you have additional education in climate and health. And I love the fact that you're a poet. So tell us what you think about this question.
So as a clinician, I think the driving force for coupling, the work in healthcare and the climate work and sustainability work is that clinical imperative that we do no harm. And when we are out providing care, of course, we are, looking to, as a hospice nurse, my main goal is to reduce the suffering or prevent suffering of my patients and their families. But there's a broader implication there of, is the care I'm providing to this person harming someone else? Is the fact that I've driven here in a fossil fuel burning car or using plastic equipment that's going to, end up in a landfill, or looking at, is the equipment I'm using manufactured in a community that is suffering harms to child health because of pollutants that manufacturing is creating? So while we want to do the right thing for our patients, doing the right thing for our patients while at the same time harming communities, vulnerable communities, it doesn't make sense, just in our moral center of how do we want to be providing better health? How do we want to provide health care for a better world? It can't just be focused on a patient. It has to be focused it has to include the environment that the patient is in. Just like in hospice care, we're looking at our patient, but we're also looking at their family and their community, and how is this whole unit working together to do this developmental process of going through a death together and finding healing in their grief afterwards. That's what we're doing with the planet right now. So it's kind of stepping back and saying, how can we do our clinical practice in a way that is also serving planetary health, not just individual health. So, that drives the work, and being part of Providence, where there is a commitment to reducing the harmful impacts of what we're doing, it definitely helps create, mitigate this moral injury that I feel like we're all participating in by kind of moving through the world the way that it's set up, and we don't really have any choice. Like I could, quit my job and go live off the grid and forage for my food, but that's not going to increase the good that I can do in the world. So, I do my clinical practice, but I also try to work on the systemic level of mitigating the other harms that are built into healthcare delivery systems while doing the clinical practice. And I'm so grateful to have the support of Beth and Providence in trying to look at those systems, just like the buildings, and how can we reduce the harm that our buildings are doing to the communities that we're in, and also recognizing, as you brought up, Beth, this the fires that we've been living through. So my community has really been through the ringer, and we're not expecting it to get better. We're expecting it to get worse, of repeated fires and floods as well, where we see exactly what Carrie was talking about, of the most vulnerable communities get hit the worst, and they have less resources to help with recovery. So we're seeing it on the ground where I live, and we try to use that experience to help educate people who are in other areas who haven't necessarily felt the dire impacts of climate change to the same degree that we have.
Great. Thank you. Well said. Very, very poignant. And I think, what you called out, that we work so hard to care for the patient and family in front of us, inadvertently causing harm that we don't intend, that we're not yet systemically looking at. We are looking at this in Providence now. We're looking at it and measuring it so that we can understand this block of harm that we're heretofore have not paid so much attention to. That's really what motivates me as well. And I think that is a really good reason that healthcare cares about the environment. Hey, thank you all for those great comments. And so we have probably 2 minutes, but we're going to take a hair more than that, to take another minute each, if you would, to answer a dream question. And my dream question is, would you each give me a brief vision of a future in which healthcare is aligned with the needs of the planet? It could even be just a few words. And let's go in reverse order. So Kenna, what would you say to that?
Well, I would say that we need to decouple capitalism from healthcare delivery, in terms of taking profit out of the system, so that the system resources can go towards the full range of health promotion activities and engage communities and respond to community needs and listen to communities. So we're really providing primary healthcare, and looking at healthcare as a human right and taking it out of the profit business. So that's my answer.
That's a good one. That's a big and bold one. Thank you. Greg, how would you answer that question?
Well, I see a larger vision from the building side of creating our own community planning with microgrids and trying to reuse as much of the energy resources that we're using now, and then maybe dispersing them out to our local communities on a larger scale. Take away from the energy we use from the grid, and then be more of a creator and be a leader in those efforts as we build new buildings and we try to retrofit some of our existing ones.
That's cool. So we would be adding to helping build resilience in the communities by doing that, literally by sharing energy. That's really cool. Thank you. Carrie, what would you say?
I would say, well, first, I would enthusiastically second what Kenna and Greg said. And I also think for me, this will look like a healthcare system where organizations first recognize just how vital this is and will put resources into hiring dedicated, not knowledgeable people who can lead the kind of large scale and rapid transformations that we absolutely need. I also think employees in non-leadership roles will be empowered and supported, whether that's engaging in bigger, larger scale projects like getting more solar panels on more hospitals or just reducing waste in their day-to-day work. And I think delivering healthcare that's aligned with the needs of a healthy planet is also going to help us just all feel more connected to each other, and we'll get to see the real results of that work. So in terms of both hard data that demonstrates the reduced emissions and reduced cost, and also things like improved air quality. So just sweeter, cleaner air that we'll all get to feel as we're walking and biking to work.
What wonderful visions. This is just great. And all three of those statements just really come together in, I think, where we hope to go in Providence, literally. And I'm thrilled to be able to hear from each of you. And thank you all, Carrie, Greg, and Kenna, for joining us today, and also to everyone for listening and watching. If you are looking for medical advice, please visit providence.org. Make sure to follow Providence on social media as listed here on this slide. Thank you all, and we'll talk to you next time.